Hi everyone, my name is Kenesha Brown. This is my project on Medicare versus Medicaid. I was unable to record over my brochure, so I will post my brochure with my recording. First, we're going to talk about what is Medicaid. Medicaid is a state and federal program that provides health coverages if you are a low-income adult, children, pregnant women, elderly adults, and people with disability. Who qualifies? Medicaid must follow federal guidelines, but coverages and costs may be different from state to state. Some states' Medicaid programs pay for care directly, while others use private insurance companies to provide Medicaid coverage. What are the benefits? States establish and administer their own Medicaid program and determine the type, amount, duration, and scope of services within broad federal guidelines. Federal laws require states to provide certain mandatory benefits and allow states the choice of covering other optional benefits. We'll take a look at mandatory benefits, then optional benefits. Mandatory benefits. Mandatory benefits covered inpatient hospital services, outpatient hospital services, early and periodic screening, diagnostic and treatments, nursing facility services, home health services, physician services, laboratory and x-ray, transportation to medical care, tobacco cessation, counseling for pregnant women. Now we move on to optional benefits. Optional benefits include prescription drugs, physical therapy, occupational therapy, speech, hearing and language disorders, respiratory care, other diagnostic screening, preventive and rehabilitative services. It also covers podiatry, optometry, dental services, prosthetics, chiropractor, private duty nursing services, hospice, service for individual age 65 or older in an institution for mental disease, and service in an intermediate care facility for individuals with intellectual disability. Those are the two benefits. Next, we want to talk about what does Medicaid cost. State can impose co-payments, co-insurance, deductibles, and other similar charges on most Medicaid covered benefits. Both inpatient and outpatient services and the amount that can be charged vary with income. All out-of-pocket charges are based on the individual state's payment for that service. Out-of-pocket costs cannot be imposed for emergency services, family planning, pregnancy-related services, or preventive services for children. Generally, out-of-pocket costs apply to all Medicaid enrollees except those specifically exempt by law, and most are limited to nominal amounts. Exempt groups include children, terminally ill individuals, and individuals residing in an institution. Because Medicaid covers particularly low income and often very sick patients, services cannot be withheld for failure to pay, but enrollees may be held liable for unpaid co-payment. Maximum allowable co-payments for eligible populations by family income. I got 4 columns, and across I'm going to have the service and supplies, the poverty level for 100%, poverty level for 101 to 150%, poverty level for greater than 150%. Okay, let's do the 100% federal poverty level. First, the services and supplies. Institution care, which include inpatient, hospital care, rehab, etc. If a person is 100% federal poverty level, they will pay $75 for institutional care. Next, we go down to non-institutional care. If a person is 100% federal poverty level, they pay $4, which the non-institutional care include physician visit, physical therapy, etc. Let's go to non-emergency use of the ER. For federal poverty level of 100%, they pay $8. Now we go to the drugs. There's two drugs category. We have preferred drugs, non-preferred drugs. For 100% federal poverty level, for preferred drugs, they pay $4. For non-preferred drugs for 100% poverty level, they pay $8. Now we'll move on to 101 to 150% federal poverty level. For institutional care, they will pay 10% of the cost the agent pay for entire state. For non-institutional care, they'll pay 10% of the cost the agency pays. For non-emergency use of the ER, they pay $8. For preferred drugs, they pay $4. For non-preferred drugs, they pay $8. Now we're moving on over to poverty level greater than 150%. For institutional care, 20% of the cost the agency pays for the state. For non-institutional care, 20% of the cost the agency pays. For non-emergency use of the ER, no limits. There's no limits. Within 5% aggregated limits. For drugs, so you have the preferred drugs, they pay $4. For non-preferred drugs, 20% of the cost the agency pays. That's it for Medicaid. Let's move on to Medicare. What is Medicare? Medicare is a federal program that provides health coverage if you are 65 or older or have a severe disability, no matter income status. Medicare is consistent of four main options: Part A, B, C, and D. Part A is hospital-related care. Part B is doctor-related care. Part C is a combination of Part A and B. And Part D is related to prescription drugs. Who qualifies for Medicare? Let's talk about premium-free Part A. Premium-free Part A, if you are age 65 or older and you or your spouse work and paid Medicare taxes for at least 10 years, you are qualified for premium-free Part A. You can also receive premium-free Part A if you are receiving retirement benefits from Social Security or the Railroad Retirement Board, or you are eligible to receive Social Security or railroad benefit, but you have not yet filed for them. Final, you or your spouse at Medicare covered government employment. Next, if you are under age 65, you can also get Part A without having to pay premium if you have been entitled to Social Security or Railroad Retirement Board disability benefits for 24 months. If you have Lou Gehrig's disease, your Medicare benefits begin in the first month you get disability benefits. Or you are a kidney dialysis or kidney transplant patient. Part A premium. So we just went over Part A free premium. Now we're going to talk about Part A premium. Part A premium is if you did not pay Medicare taxes while you work and you are age 65 or older and a citizen or permanent resident of the United States, you may be able to buy Part A. While most people do not have to pay a premium for Part A, everyone must pay for Part B, C, and D if they want it. Part B monthly premium is deducted from your Social Security, Railroad retirement, or Civil Service retirement check. If you do not get any of these payments, Medicare send you a bill for your Part B premium and the private insurance company bills you for Part C and D. What is covered? Okay, what is covered under Part A? Partially covered: inpatient hospital stay, skilled nursing care, hospice, home care. Part B, which is also partially covered: doctor visit, surgery, lab tests, medical equipment, preventive exam. Part C, like Part A and B, with predictable out-of-pocket costs and more coverage. Things that are often fully covered are wellness services, vision exam, hearing exam. Things that are often partially covered on the Part C are eyeglasses and hearing aid. Part D. Part D help with the cost of prescription drugs not covered by original Medicare, which on the Part D, prescription drugs covers sometimes or covers some. Medicare plan option. We got Part A premium. Part A premium is most people don't pay a monthly premium for Part A. If you buy Part A, you'll pay up to $437 each month. If you paid Medicare taxes for less than 30 quarters, the standard Part A premium is $437. If you paid Medicare taxes for 30 to 39 quarters, the standard Part A premium is $240. Part A hospital inpatient deductible and coinsurance. 1,364 deductible for each benefit period. Day 1 to 60 is zero coinsurance for each benefit period. Day 61 to 90 is 341 coinsurance per day of each benefit period. Day 91 and beyond, $682 co-insurance per each lifetime reserve day. After day 90 for each benefit period, up to 60 days over your lifetime. Beyond lifetime reserve days, all costs. Part B premium. The standard Part B premium amount is $135.50. Part B deductible and co-insurance, $185 per year. After your deductible is met, you typically pay 20% of the Medicare approved amount for most doctor visits slash services, outpatient therapy, and durable medical equipment. Part C premium. The Part C monthly premium varies by plan. Compare costs for specific Part C plans. Part D premium. The Part D monthly premium varies by plan. Compare costs for specific Part D plan. higher income consumer may pay more. Difference and similarities of Medicare and Medicaid. Medicare and Medicaid are two separate government-run programs. They are operated and funded by different parts of the government and primarily serve different groups. Medicare is a federal program that provides health coverage if you are 65 plus or under 65 and have a disability, no matter your income. Medicaid is a state and federal program that provides health coverage if you have a very low income. If you are eligible for both Medicare and Medicaid, which is dually eligible, you can have both. They will work together to provide you with health coverage and lower your cost. Also know that while Medicare and Medicaid are both health insurance programs administered by the government, there are differences in covered services and cost sharing. Both plans are run by federal agency Center for Medicare and Medicaid Services. These are my reference. Thank you. Hope you guys enjoy.